Hello, it's Dr. Rhonda Johnson. Today's Tuesday, April 11th, 2023. Today I'm talking about preeclampsia. Why? Because April is National Minority Health Month, and I'm talking about diseases and conditions that adversely affect Black people and people of color. Well, what is it? It's a high blood pressure condition that develops during a woman's pregnancy or in the postpartum period. Now, the rate of preeclampsia has increased 25% in the United States in the last 2 decades and is a leading cause of maternal and infant illness and death. Now, the preeclampsia rate is 60% higher in Black women than in white women, and Black women are more likely to develop severe preeclampsia. Now, preeclampsia and its partner, eclampsia, are one of the major reasons for Black women having maternal death following childbirth. Now, preeclampsia is a condition that I know personally. I had it in all of my pregnancies. So what is it? What causes it? The cause of preeclampsia remains unknown even as of today, but you can diagnose it, your doctor can diagnose it by the presence of high blood pressure in the mom-to-be, usually after the 20th week of pregnancy. It can be associated with levels of protein in the urine and also the development of decreased blood platelets, trouble with the kidneys or liver, trouble with fluid backing up in the lungs and the extremities, or if it's severe, signs of brain trouble, such as visual disturbances and seizures. Now, symptoms of preeclampsia can be vague. They can be headache, abdominal pain. You can have shortness of breath. You can have swelling of the hands and feet. You can have visual disturbances such as sensitivity to light or blurred vision. Now, most women with preeclampsia can be managed during their pregnancy. And I don't want to go into that because I'm not an obstetrician and you need to see your obstetrician for that. And if you're managed well, you can deliver a healthy baby and fully recover. But some women go on to progress to severe preeclampsia, and it can happen very quickly. That's why it's so important to have regular prenatal visits and a relationship with your nurse midwife or your obstetrician while you're pregnant. Now, some risk factors for preeclampsia include pregnancy when you're young, like under 15 or older than 35, your first pregnancy, if you've had preeclampsia in a previous pregnancy, if you're having twins or triplets, if you have autoimmune disorder, if you have obesity, diabetes, or kidney disease, if you're African or American or Hispanic, and if you've had COVID infection during your pregnancy. COVID infection is a vascular disease, causes damage to the blood vessels in the mom and the placenta, and can cause life-threatening hypertension in pregnancy and preeclampsia. Now, postpartum, you can have preeclampsia. It's not as common, but it's more common in Black women. And you can have high blood pressure and too much protein in your urine after the baby is born. Usually shows up between the first 48 hours after birth, but it can happen up to 6 weeks later. That's why it's so important not to only get prenatal care, moms, but also to get your postnatal care. So, I know it's hard sometimes to get to that postpartum checkup if you have other children. You may be a single mom, but this is one time you should ask for help. Ask people that you know to make sure you get your prenatal and your postpartum checkups. Now, doctors routinely check for blood pressure and protein for women during their prenatal visits. So many people ask, the pregnant mom, what can I do to help? And that's a good question. One of the things that you can do, and this is just my opinion, is on that baby shower gift list, get the mom a home blood pressure monitor. It can be one of the best gifts that you can ever give her. You can get a wrist one, or you can get an arm one, you can get the $20 one, or you can get the $60 one. But put that on the baby shower list. Also, you can volunteer to take moms to be to their prenatal checkups, or when she's had the baby, to her postpartum checkups. Volunteer to babysit the kids, do a grocery store run, do some laundry. Whatever you can do, do it and help a mom-to-be. That's my message today. I know it's a lot. Again, always consult your obstetrician for your prenatal questions or your nurse midwife, but get some care and have a healthy baby.